Hi, Senya. It's good to see you again.
Hi.
So last time I know that we did some physical exam with you. We got some x-rays taken for you. And now we're going to sit down and take a look at what we found with those, okay? So I'm just going to briefly run over your chief complaint again, just so we make sure we have everything. So you came into the office with history of right low back pain, and most of the time it's like a 1 to 3 out of 10. You don't feel it that often, but when it flares up, it's a 7 out of 10, and that happens around the time of your period. And then it also radiates down the front of your thigh towards your knee, and you feel kind of like tingling and numbness with that, right?
Mm-hmm.
Okay, perfect. So before we get into how we're going to go about helping you, I want to take some time to show you what the spine looks like and what the nervous system looks like. Because we're going to be working with it pretty much all the time, I want you to really understand what we're doing. So this is your spine, and we know in science that the brain controls all the functions of the body, right? So pretty much everything you're thinking about and not thinking about, your brain is doing that for you. So your brain sits up here on top of the skull, and the brain is able to control the functions of the body through the nervous system, and the nervous system is going to pretty much be an extension from the brainstem, which is right here. It's going to come down through this hole in the top of the skull right here. It's going to pass through this first bone in your neck, and it's going to go all the way down to your tailbone. And as it travels downwards, it's branching off all these nerves, as you can see, at every segment. And these nerves are the ones that innervate every cell, tissue, and organ in your body, so they're really important, right? So you can think of the nervous system as a freeway. So it's the freeway and the communication system between your brain and your body. That's how we know what's going on, and then we're able to adapt to the environment, right? And so what can happen is that these bones are supposed to be there to protect the spinal cord, but what can happen is that these segments are movable, and with different types of traumas, whether it's big or small or different stresses, these bones can shift slightly out of alignment, and it's going to what do you think is going to happen to these nerves once the segment is misaligned?
They're going to get compressed.
Yeah, so it puts a lot of tension on these nerve fibers that are coming out, and what do you think is happening to the message that is supposed to be traveling in that nerve?
It's being reduced.
Yeah, so it's not really, it's being interfered with. So we know that when a nerve is being interfered with, it's going to cause all kinds of different aches and pains and dysfunctions that you might be feeling, just because the nerve flow isn't optimal. So what we do as chiropractors is we use specific analysis methods to find where in the spine that's going on, and then we're going to deliver gentle and specific adjustments to realign those segments. And when we do that, it's going to release the tension that's being put on these fibers so they can restore the flow of nerve function to that area.
Mm-hmm.
And in doing so, we can expect those aches and pains to disappear as your normal healthy function is restored. Does that make sense?
Mm-hmm.
Okay, great. Just one more thing to add to that. So when we call this subluxation in chiropractic, when those bones are shifting out of alignment. So you probably hear me using those terms a lot. All right, so now we're going to go into some of the things that we found in your history and exam. So in your history, you told me that you've been involved in a couple of car accidents, one of which was when you were 10 years old and you fell out of a moving vehicle. You landed on that right side, the side that you're feeling pain, and then you blacked out. So I believe that car accident is related to the symptoms that you're experiencing today. And in addition to that, we know that you were diagnosed with lipoma from CT imaging, and that lipoma is sitting right where you're feeling those symptoms as well. So a combination of those things, as well as we found that there were some indicators for what we call lower cross syndrome. So lower cross syndrome is a combination between muscles that are too tight and muscles that are too weak. So we have tight hip flexors, these muscles right in the hip crease here, as well as tight back muscles. And then we have weak core muscles, and then weak glute muscles as well. So it's really common to see lower cross syndrome in people who sit a lot, and that makes sense for you since you're a full-time student. You probably do a lot of sitting for studying and everything, and during class. We also found that on your exam, we had those weaknesses in those muscles, as well as on X-ray, we saw a couple of findings that correlate with lower cross syndrome. So we're going to take a look at your X-rays in a second, but I first want to show you what a normal X-ray looks like. So here, this is an X-ray of your low back area. So, or not your, but this is a normal low back X-ray. And so look at what the curve looks like here. And then this is your X-ray. So what can you tell me? What looks different?
The curve is more defined, so it looks more curvier.
Mm-hmm. Yeah, we did notice that you have, it's called hyperlordosis, so an accentuated curve in your low back that is consistent with lower cross syndrome, and it's going to put some extra stress in that low back area, so we want to be careful of that. As well, we can see here that this bone right here is like the top of your hips, so it's called the sacrum right here, and the angle that it's making with the floor is what we're looking at in particular. So yours is increased, which is telling us that your entire pelvis is shifted forward into what's called anterior pelvic tilt, and that's another hallmark of lower cross syndrome as well. So now that we've had a chance to go over your exam findings and X-ray, we're going to make a plan of action for you. We're going to call it the care plan. So for you, I would recommend that we see you for 12 visits over the course of 8 weeks. We're going to start you off twice a week for the first 4 weeks, and then based on your progress, we can probably drop you down to once a week for the remaining 4 weeks. And at the end of that 8 weeks, we'll have a reevaluation for you. What's really important though is that as we're starting you on care, I want you to really commit to coming to these visits, because it's really important that we get you with a strong start and a lot of momentum going into your healing process. And no plan is complete without setting goals. So I know that you were telling me that you had 2 specific goals in mind. First of all, you wanted to reduce the number of flare-ups you had from once every 2 months to once every 6 months. Is that right?
Mm-hmm.
And then the second goal that we wanted to work on was increasing your toe touch increasing it 2 inches in 6 months as well. Okay, so we're definitely going to tailor your care plan around those goals, and because we're working as a team now, I also want you to do some things outside of the office for me. So I have a list of exercises for you to do. I'm going to give the handout to you once we're done with this meeting, but essentially I've picked out these exercises for you specifically for that lower cross syndrome, and we're going to work on those weak muscles. We're going to stretch out the tight ones, just so we can start to balance out the muscles there. And in addition to the exercises, we want to make sure that your lifestyle is still supporting your care. So I noticed on your intake form that you're currently having 2 to 3 servings of vegetables per day. So we want to increase that to 4 to 5. And then you're doing really well with your water intake. I want you to keep up the 6 to 8 glasses per day. That's great. And also making sure that you're getting a good night's rest every night. Okay.
Sure.
Okay. So based on the exam findings, I think you're a great candidate for neurologically based chiropractic care, and you're a really healthy lifestyle in general, great outlook and attitude. So I expect that you're going to do really well with chiropractic care.
Thank you.
I'm excited to start working with you.
Yes, am I.
Thank you.